We're going to talk today about going to the best doctor because you have the best body, or you don't. So if you don't, why bother? If you do, why choose anything less than the best? Today we're going to talk about the second chance for those who have survived their first heart attack or those who want to. Now, this is kind of important because we're getting down and dirty about real life. And we're going to have a book coming out where we detail much of this scientific information called Heartbroken. The top 5 reasons to doubt your heart doctor. Well, if you're going to the best heart doctor, why would you doubt him? Well, doctors deserve your trust because they've gone through all this education and training and they do an important job and so on. But the question is, do they? Because dishonesty betrays your trust. If they turn their back on the most advanced in science, is that delivering the best to you? Is that carrying through with the trust that they owe you? So is your doctor lying to you, or is he simply ignorant? Well, interesting question. He doesn't look like Pinocchio. He's probably not lying. Maybe, as Will Rogers says, everybody's ignorant only on different subjects. I'd hate to think that your doctor might be ignorant on the best technology to evaluate and treat your problems, especially if it's your heart problems. Now remember, your doctor doesn't have angel wings or a halo. He's just doing his job as best as he knows it. Well, you hope it's as best as he knows how to do. He does have prestige and respect. And indeed, that's important in society because we have to trust somebody with something as important as our life. It's a little bit more important actually than our financial planning. And we spend a lot of time looking over which financial planner we're going to get. A whole lot less time on finding the right doctor. But remember, only your life hangs in the balance. So it's real important that that decision be the best for you because only you get buried in your coffin. Sad but true. It is what happens. You know the old story, doctors bury their mistakes. They also bury their successes because, you know, life runs out at the end of the term. Okay, but you want yours to be a long time. And yet, why do doctors miss the risks? Okay, why do players on a playing field drop dead? Okay, Nicholas Ferrer dropped dead of hypertrophic cardiomyopathy and a rhythm. Doesn't that sound important? What that means is it was a diagnosis that was missed by his doctors in the best of health on the playing field, okay? Now, proper diagnosis can save lives, and they actually screened participants for, intensive sports like this, and they found that people who were disqualified showed innocent or negative findings on just a regular resting EKG, but clear pathological things on their exercise, their stress test, and they were disqualified because of these findings. In other words, it was something where when you get out there in the field of play, you're going to get in trouble. And indeed, some of them get in serious trouble. It's very important that you play patient, okay, because your doctor will tell you what to do. Now, if that advice is good, that's great, but remember there are play doctors, okay? And these are the TV doctors who look like they solve everything. Unfortunately, they don't. It's very important to be a doctor, not just have the title. It's very important to assume that the patient is going to get the best care from you because if you don't deliver it, you'll refer to someone who will. In other words, it's important to know your limitations, but also very important to know the facts of the matter, even though it's against what other doctors say. What if the other doctors are clueless? What if they haven't an idea of what we're talking about? They actually have a solution for that. It's a prescription for you. And by the time we see patients, often they have 6, 8, 12 prescriptions on board. You have to remember that you get the first one for the problem and the second one for the side effect for the first one and the third one because of the side effects of the second, or it didn't control the new symptom and whatever. And pretty soon you find out that it's not working as well as you thought it would work in your golden years. They look more like they're rusting. Remember, what do you call the doctor who graduated last in his class? Doctor. How do you know? You don't. But remember, you're going to who you want to be the best to take care of you. Now, there are scientific facts that can uncover the truth to rely on so that your branches either fade, wither, and die, or they flourish and you have a wonderful time in your life. Honest to goodness, you can break the law and get away with it. Often. I mean, everyone does. I would suggest you don't break the law of gravity. This is called a natural law. Natural laws will catch you every single time, even when you think the cop isn't around looking. That's the way it works. Well, guess what? That's the way it works inside your body. Natural law is biochemistry. Natural law is physiology. And if you don't get quite on target with that, you're going to end up suffering the consequences. Should we always trust the studies? Because your doctors say, well, there's studies on that. Well, it turns out one commentary is that about 2/3 of the findings published in medical journals are refuted within a few years. In other words, it was fake news. Even though everybody accepted it, adopted it, and said this is great because it reinforced their bias, their way of looking at the world, it's refuted, but you might not see the article that refutes it, so you're still practicing with old understandings. That same commentary was that 90% of physicians' medical knowledge has been found to be substantially or completely wrong. That's worrisome because there's a 1 in 12 chance that the doctor's diagnosis will be so wrong that it causes the patient significant harm. How would you know? You don't know because remember, you're assuming you're going to the best doctor for the best care, and it's just you that's the problem. You're just not doing as well as you would like to. So should you doubt your doctor? Well, knowledge is power. For the doctor, certainly, because he can make better decisions. For the patient, because you can actually assess the decision-making, the evaluation, the proposed treatment, the expected results. You now have a sounding board if you have the knowledge. So we suggest that you doubt your heart doctor. We're going to present 5 reasons why you should doubt your doctor. Then we'll present how to solve your doubts. That would be kind of nice because if you want to consider your future, well, by golly, what else is there to consider? Because if you don't make correct decisions now, you don't have much of a future. So what are the 5 reasons you should doubt your heart doctor? Well, number 1 is tests. Theirs. Number 2 is drugs. Theirs. Number 3 is operations. Theirs. Number 4, they are clueless about inflammation. Number 5, they are clueless about nutrition. These last 2 are important because they get no training in this in medical school. Well, they get a little bit of training, not enough. So why should you doubt your doctor? Let's talk about tests. History is his story. His story. In other words, your story when you go see the doctor. You know, one study showed that doctors interrupt their patients on average within 23 seconds of the time that they start to tell the story. You know why? We already know what's wrong. We don't have to listen to you too much more. We've just already put you in a cubbyhole. In 25% of the visits that were studied, the doctors never even asked the patient what was bothering him during more than 300 visits that they looked at. The doctors spent an average of 1.3 minutes explaining crucial information and thought they had spent more than 8 minutes doing so. That's a little shortfall. The EKG is normal until it's not. Remember what I said about the resting EKG and the sports folks? Well, what about you? I had a fellow come into my office, 2 o'clock in the afternoon. I said, you know, I'm kind of suspicious. Let's do an EKG. We got that. Yeah, it's normal, but I don't know. I'm not liking it. Let me put you in the hospital overnight. Let's just check you out. That was 2 o'clock in the afternoon. At midnight, the CCU nurses called me and said, we have just moved him into the bed because he was in a monitored bed. We had the continuous EKG they were watching. He had his heart attack at midnight, 10 hours after I saw him. I was seeing something happening. So a regular EKG has to be looked at in light of the patient, not just the test. And he survived quite nicely. Is the EKG just squiggly lines where there's a great deal of disagreement about interpreting? And, you know, it really, the EKG, resting EKG, does not have the sensitivity and specificity to be a good test on its own. It is, however, the arbitrary gatekeeper, and we'll do an EKG, it's normal, that's fine, don't worry about it. But only 66% of the later proven crises, in other words, heart attacks, were identified and advanced to the next level of care on the basis of the EKG and the doctor's evaluation. These patients didn't get the treatment they needed if they survived. Senior doctor status counts. For every 5 years of experience in practice, that provides a 6% increase in the odds of accurately understanding what the EKG is trying to say. Well, you know, clinical medicine is not a precise science. That's why they call it a practice, not a perfect, okay? So here's a comment from a novelist, okay, who's a physician. How did you know the right thing to do? Alex Orkin asked, his voice high with elation. Obviously, he's getting better, right? The point, of course, was that I didn't know. His senior attending doctor and I were forced to make our decisions under conditions of uncertainty. This was medicine, not physics. It was a realm often of educated guesswork rather than arithmetical precision. In other words, we're supposed to take the big picture and see all the little parts that are moving at the same time. That's called clinical medicine and decision making. Now, you have to remember that we select the people who need to have these tests, not just because we can offer them, because a stress test stresses you. Now, whether you're doing an exercise one or a chemical stress test, that might reveal underlying blockage, occlusive changes, or myopathy, that's the heart muscle not working right, but the results could still be misleadingly normal, or, worrisomely, falsely abnormal, because if they're abnormal, we have more tests for you, okay? One professor of medicine says the stress EKG is never by itself certain, regardless of what your doctor might say, okay? It can be used to move the probability up or down of there being coronary heart artery disease, but it can't absolutely rule it out or diagnose it in. So maybe yes, maybe no. Exercise stress tests aren't perfect. 50% of women and 25% of men with reversible perfusion defects. In other words, they got blockage disease that we're able to pick up and see. Those were detected by nuclear stress tests, the special scans that we do, but they had normal exercise stress tests. In other words, that EKG didn't show what was clearly there. Maybe yes, maybe no. But coronary artery, heart artery disease produces plaque in the artery, blockage, like I have shown you. And these non-obstructive plaques, in other words, it's not blocking the flow so much that you're in trouble from that, but they can break off. It's called unstable plaque, okay, or vulnerable plaque. We started learning about this 30 years ago, realizing that the cap on these blockages is not necessarily solid, and I guarantee you if it breaks off, it will find something south of there that is smaller than it is, and that's a little tiny heart attack, or gangrene, or blindness in your eye, kidney failure, and so on. This acute blood clot formation from the plaque rupturing can lead to a heart attack, and the false positive and false negative studies limit the usefulness of the stress test in many patients. In other words, it's not one test. We're back to looking at the whole patient. You've heard the term holistic medicine. People honestly go, I don't know, that sounds a little wacky. I think it's the whole person and the whole cluster of their tests and evaluation. That's what holism is, looking at the big picture. Well, but maybe yes and maybe no. The challenge of stress testing identifies only major blockages, but often it's the minor, not the major blockages that cause heart attacks or sudden death. Stress tests can't see these minor blockages. You can pass a stress test and have a major heart attack the next day. Or, like my patient with the normal EKG at 2 in the afternoon, has his heart attack at midnight. He would have awakened dead, except for the fact he was in the hospital on a monitored bed and down to the coronary care unit inside of a couple of minutes. Here's something interesting. Maybe yes, maybe no. The Ohio State University Medical Center professor warns that what is surprising is that the fact that all the research that describes stress testing that has gone on for more than 40 years was done in men. What about women? It was done in men, okay? Unfortunately, everybody's thought that the stress test is so good, but actually the test sensitivity for blockage in the heart arteries is only about 45%. Anybody got a quarter? Flip it. Maybe yes, maybe no. False negative results are unlikely to be discovered, and true negatives are less likely to be confirmed for every cardiovascular non-invasive test analyzed. In other words, if we're not squirting dye in your arteries, called a heart catheterization, maybe yes, maybe no. There's no type of test that escapes this verification bias effect. If the doctor thinks you've got a problem, he sees it in your tests. If he thinks you don't have a problem, he sees it in your tests. Now remember, well, just to be sure, we should do your angiogram, your catheter test. Despite the claimed safety of this, incidents and deaths still occur. Well, what are the odds? 0, didn't happen to you, or 100% happened to you. And interpretations can vary wildly on this. There was a very interesting study done and reported, oh goodness, over 20 years ago, where they took 10 catheter tests, angiogram picture sets, and 10 cardiologists at a meeting and said, could you guys do this? We're just doing a test about how well people interpret it. It turns out that the interpretations vary widely between the 10 cardiologists. Oh, well, okay. So they went back the next meeting, had these same 10 cardiologists, said we got some new ones because we need to, kind of figure out what our old, results meant. And they had them read them. They didn't tell them it's the exact same angiograms that they saw the time before. And guess what? They couldn't repeat their own interpretation with any reliability. So they can vary widely. Unexpected deaths. Well, nearly a third of the unexpected deaths occurred suddenly after an uneventful angiogram. Patient goes through the angiogram, does just fine. A third of the people who are going to die associated with that had no problems during the angiography. Wow. Death can occur suddenly 10 minutes to 10 hours after the angiogram. This is not, oh, well, let's just go do it. Oh, you'll do fine. Everybody does fine. We just need to see what's going on inside you. What about the cholesterol confusions? Mainstream medicine insists on lowering your cholesterol. They have to test it every few months. Well, the studies suggest that higher risks are from the drugs they propose than from the possible benefit of suppression of cholesterol blood levels. LDL, HDL, triglycerides, coronary artery disease. Do you know that half of the people who show up with a heart attack in the emergency room have been shown to have LDL levels about 100, which is the goal of treatment. Actually, they're just lowering it now to 70 because they need to put you on more drugs. But before admission, only 21% of the patients were even receiving any lipid-lowering drugs. In other words, lowering the cholesterol doesn't seem to have a whole lot of benefit. So why do we do it? I'll let you surmise that. What happens if we lower the LDL even more? Predictors for high LDL, being female, no diabetes, history of high blood fats, no prior medications to lower it, and then presenting with an acute coronary syndrome. In other words, you come in and you got chest pains associated with your heart. Well, now wait a minute, okay. In a large group of studies, almost half of the patients admitted had levels lower than 100. So that's not exactly what we call a real good predictor test. Their HDL levels were below 40. That's kind of important, okay. These findings provide further support for the recent guideline revisions that we should lower LDL. What? Wait a minute, what? They just give you the data that says it doesn't matter much and say now we should lower it more. In other words, if the only tool you have is a nail, or as a hammer, then you just want to hammer that nail harder, regardless of whether it's producing the result. What about other tests? Thyroid, for instance. The T4 is generally misinterpreted. The T3 uptake is rarely useful. That's what they always do. The TSH is often misinterpreted. Why am I saying these things? I'm on the receiving end. I see what the other doctors have said about the tests or even my treatment programs. The RT3 is sometimes helpful. The FT4 is sometimes useful. The free T3 is rarely ordered, but that's absolutely key. That was shown by Broda Barnes back in 1976 when we couldn't even measure free T3, but people who didn't have balanced thyroid had a higher incidence of heart attacks. Hypothyroidism is a problem with the thyroid gland not putting out enough thyroid, but Wilson's syndrome is where you seem to have enough, but you're not processing your thyroid correctly. You don't convert the T4 to the T3. Critical to understand, very difficult for doctors to see. All right, that's the test. That's why you should start doubting your doctor there. What about the drugs that they use? Well, you know, we give diuretics. Often those are water pills, fluid pills. But what happens is we get magnesium and potassium, which are critical for heart and kidney function. They're rarely checked and they're rarely properly replenished. You know, the doctor telling you just need to take your vitamin tablet once a day or whatever is not adequate nutritional information. In fact, we are killing you slowly. Magnesium depletion is related to what we call loop diuretics and thiazides, the most common of the fluid pills given. Among the patients treated with diabetics, more than a third show low magnesium. Arrhythmias, that's a heart rhythm disturbance, and sudden death attributed to the magnesium depletion could be prevented by something simple called magnesium administration. If you start looking at your health food stores and the health section at your pharmacies, you start seeing more of these things are starting to show up on the shelves. Hopefully they're the correct ones, because the wrong formula doesn't help you terribly much. How about hypotensive fog and falls? You know, in their insistence on tight blood pressure control, we need to get your blood pressure down. Doctors ignore the fading contribution of the arteries, which are elastic when you're young, so that when your heart pumps, the blood vessels expand a little bit, and then when your heart is resting, they are elastic like a rubber band and come back a little and push the blood a little bit further. But as patients grow older, they have more hardening of the arteries, less contribution there, and because we keep their blood pressure so low, they get into a brain fog, they fall. This steals their comfort, their security, and the safety of their daily lives. This is, again, the big picture, not worrying about risks that might come years down the line, but risks tomorrow from a fog or fall that gets you in trouble. Now, is this real? Well, cognitive decline, that means thinking problems in the elderly, is associated with chronic cerebral hypoperfusion. Fancy way of saying your brain didn't get enough blood flow. 2/3 of the subjects tested were hypotensive. In other words, they had too low a blood pressure after 30 minutes of quiet sitting. How many older folks do you know, when they sit after a while, they just kind of doze off, even if it was their favorite TV show or they're enjoying their reading? Cognitive performance, thinking, is significantly better in individuals with higher diastolic, or the lower blood pressure numbers. Wait a minute. Talk to doctors about that. You'll find very few will understand that concept. Statins. You know, statin drugs are the ones that we use for blood cholesterol control, because everybody's got to slam their cholesterol down. But in their insistence for brutal cholesterol reduction, doctors prescribe ever stronger drugs and ever higher dosages, and require frequent unnecessary blood testing, because if you remember, I've told you before, cholesterol is not the culprit. LDL is not the devil that it's portrayed, and many heart attacks occur in patients with target levels, as we've seen, even when they're not on statin drugs. But the drug side effects are real. So LDL is not the problem, but drugs become the problem. So we have kind of a Chicken Little situation. Doctors and labs and everybody in the media screaming, the sky is falling. The sky, we've got to get everybody on cholesterol-lowering drugs. In fact, there have been ideas about, why don't we put that in the water, and then everybody gets it easily. And indeed, it's the coyote dropping the anvils. Here, he needs help because that roadrunner got him once again, okay? That's what we're like as unsuspecting public who are not doubting our heart doctors. LPA actually can serve, LP-little-a can serve as the flex seal inside your system. Now, the primary thing that they're trying to lower is LDL inside your blood counts, okay? But in patients at very high risk, they say the level should be really low, but in patients with progression of hardening of the artery disease, okay, despite treatment, an important role could play the high level of lipoprotein little a. In other words, it's trying to protect you, and they're trying to slam it down. You're in trouble. We already know that. That's why you come to the attention of your heart doctor. But he's trying to slam down the body's attempt to do something right. I want you to remember one thing, it's a very important lesson to take home. Your body never does nothing wrong. It always does exactly what it's supposed to do at exactly the right time. It's just you've given it a situation that may be very hard for you to have comfort and survival. It's your problem, not the body. It's doing what it's supposed to do. Here's an example. The concept that Lp(a) is a surrogate, in other words, a replacement for ascorbate, which is vitamin C, is suggested by the fact that Lp(a) is found in the blood of primates and the guinea pig. We are primates. Apes are primates. They have lost the ability to synthesize vitamin C. Every other animal on the planet does it. But it's rarely in the blood of other animals because, they just tickle out what they need. The properties of Lp(a) are shared with vitamin C. In accordance with that idea, the acceleration of wound healing and other cell repair mechanisms happens when you have a lot of Lp(a). Oh, did I mention this is my friend Matthias Roth and my former wonderful hero Linus Pauling. So these are not just casual observations. They noted that the strengthening of the blood vessel walls and the prevention of cholesterol and other fats getting you in trouble was associated with enough vitamin C on board. High plasma Lp(a), that means circulating around, is associated with coronary artery disease and other forms because it's there to help protect you when you're already getting in trouble. It's not causing the problem, it's the fix for the problem. When you lower the fix, you get more advancing problems. Isn't it strange that your doctors would actually be creating more problems for you by trying to lower it? The elevated level of this Lp(a) indicates a patient with a higher heart risk, regardless of the fact of whether that's the only marker out there, and it's an active factor in protecting you. It's not pathologic for you. Yet, your doctors are going after your own internal protection. You don't need an outside one. Well, actually, you do. You need a lot of vitamin C, which is very important, and Dr. Pauling showed that many, many years ago. So the idea is we really need to get on board with understanding what's happening before you treat it. We're not going at the end result and slamming that. We're going at the beginning and correcting the problem. Isn't that what holistic medicine should be about? As an aside, incidentally, vitamin C, producing Lp(a), also lowers the risks of cancer. The confirmation of this could be a universal therapeutic target. In other words, for the prevention and treatment of cancer, try and talk with your doctors about that being so important. Remember, you really don't need extra vitamins. In fact, when my patients go down to MD Anderson, they take them off all of the nutritional programs I put them on. Talk about side effects. Doctors don't talk about side effects. They are either 0 or 100%. You don't get it or you do. Well, that's kind of worrisome because when you take a look at musculoskeletal systems or muscles melting because of the statins, their conclusion is that that's not likely statin related. Really? Okay. Because switching statins or using lower doses often will help in many patients. In other words, it was apparently drug specific. And they say there's a growing population of individuals who experience intolerable musculoskeletal symptoms with multiple statins. In other words, that drug class is really hard on people, not just that one individual. It's critical that clinicians have an approach for managing these statin side effects, and they say the muscle wasting, the transaminase, the enzyme elevations, the injury pattern from the cells, the increased incidence of diabetes among some patients. Connections between statins and other processes such as kidney and brain function have also been studied with mixed results. Which part of the mix do you want to be in? You know, it's kind of like saying that arrival of airliners to this airport from that other airport has been studied with mixed results. You want your airliner to arrive 100% of the time with an uneventful flight. On the other hand, remember, your body is that airliner. Those are the mixed results that we're talking about. All right, so that's why we should begin to doubt our doctors because of those drugs. What about the operations involved? Well, stents are like a Chinese finger puzzle in reverse. We stretch it out, slip it in, remove the inside, and it pops open. And that's how it's supposed to open up things. But that's a brutal disruption of the hardened plaque, the blockage disease. It creates continuing stress against the arterial walls. It exposes all the blood cells to radiation because we have to radiate the area to stop it from blocking down again. It often requires repeat procedures because the technology really isn't all that great. One study found the death rate from doing angioplasty, that's what it's called, was about 4% or so. The complication rate was about 13%. I don't know about you, but it's starting to sound more like Russian roulette here. The rate of reclosure in these is scandalous. More than a third of the treated arteries close within about 6 months. Even though it doesn't work, the medical establishment goes to great lengths trying to fix the procedure itself. Stent redos, okay? It's similar irrespective of the stent type, and the hazard remains and should be minimized. Yeah, that's what the doctors say. Bypass is often unneeded. They say you're a ticking time bomb. We need to operate this week. But bypass surgery involves major risks, a 2 to 5% death associated around the operation, depending on how sick you are, how bad it is, your other conditions, and your doctor, okay? Grafts, in other words, the bypass grafting that they put in routinely block off, and repeat grafting is common. That means it worked so well the first time, let's do it again. Bypass is often unneeded. It does not cure heart disease and does not extend longevity in most patients. Do you know when these data first arose? In the early 1980s. This is not new information. After 10 years or so, the failure rate of these grafts is about 75%. More than 10 times as frequent as bypassed arteries is the blockage progression of significant heart disease. In other words, it doesn't do anything to stop the underlying problem. It just bypasses that particular little point of trouble at the moment. It's kind of like the police moving the wreckage off the road, but there's still all this other backup of the traffic, and that still is going to lead to more problems. Bypass is often unneeded. A study in 1990 showed that a person after bypass runs a higher risk of stroke, anxiety, depression, hallucinations. The same study concluded that bypass was more traumatic than any other surgery, regardless of how well you seemed to go through it. Reoperation is important. Angina, heart, chest pains reoccur in up to 1 patient in 5. That's in the first year. And then increasing by about 4% every year after that, which is why you get the second bypass. That's required in over 30% of the patients by 12 years after the surgery. In other words, you're looking at, well, you save your money up because you're going to do that again. For God's sake, don't let your insurance lapse. Reoperation carries a higher death rate, and the benefits diminish and the risks increase as we do more and more operations. The VA study, the Cooperative Surgery Center study, the National Institutes of Health, all of these studies 35, 40 years ago showed that, the survival rate with medical treatment, that's with the drugs we had back then, not now, was about 88%. Oh, I'm sorry, 87%. For surgery, it's 88%. So do you want to have the drugs and survive at the same level as you would for the surgery? It's your thought, because surgery doesn't sound like that much fun. 10-year follow-up on those studies shows that about 80% in both groups are still alive. Okay? In other words, the follow-up on surgery doesn't seem to provide a lot of longevity benefit. And among the low-risk patients, the mortality was significantly lower those treated with drugs rather than surgery. In other words, if you really don't look like you're going to get in trouble, better to be on the drugs rather than let's do your surgery before you get in trouble. Major study in the New England Journal showed that progression of significant heart disease was more than 10 times as frequent in the bypassed arteries. In 1987, Harvard published a study showing that if we bypassed you too early, while we're in there, let's go ahead and do this other one too, that accelerated the blockage on that one that was not as blocked. Among the side effects of bypass are pneumonia and bleeding and heart attack. Wait a minute, I thought that's why we were doing it, to prevent that. Heart pain, irregular heartbeat, bursting of the wounds, that's not fun, and reoperation due to grafts that have closed off, sometimes within a few hours or days. With each repeated procedure, the risks increase, not a little, but geometrically. That means a lot. In fact, angioplasty and bypass are being performed repeatedly on the same patients. Angioplasty is like a potato chip, says one of the leading heart doctors. You can't have just one. In the Emory study, 14% of the bypass patients and 63% of the stent angioplasty patients required a repeat procedure within 3 years. So it seems like you start down that road, that's a funnel that keeps on going to the bottom. As part of the new marketing strategy, where practitioners are behaving more like entrepreneurs in a profitable sense, seeking out and acquiring new patients, EKGs and stress tests are often offered at very low cost by the hospitals, kind of like a loss leader, because once we get you in, those bypasses and stents are expensive and recurrent, as we said. But those screening devices are often used to find potential patients and funnel them into bypass or angioplasty, and as a result, even patients who aren't sick can find themselves under the knife. Pump syndrome, almost never talked about, but heart-lung machines are primitive technology that result in distressing residual problems in no less than 2/3 of the operated patients. And everyone has a change in personality or thinking ability that doesn't necessarily mean positive. Pump syndrome is daily when you have it. During the first year after surgery, up to 2/3 can have heart attack, stroke, rhythm disturbance, worsening blood pressure, congestive failure, or pump syndrome. That's the personality and mental function change as a result of having been there. Remember, this is something that's not like been there and took it back. It's no tags back. That one's a done deal. What about post-operative mortality? Well, perioperative deaths are those that happen in the few days around the operation. And you can explain that because, well, they had serious disease, there were other illness problems, other complications. But less acceptable are the post-op deaths happening months and years later, and those do. But you know, the reassurance from your doctor is, hey, we did what you needed. You're in good shape. Go on about your life. For God's sake, don't do chelation. No. That risks your life. Well, if chelation had any of the statistics like I've just shared with you about angioplasty and bypass grafts and heart drugs, we'd have been out of business a long time ago. What else should you use to doubt your doctor? Well, how about the idea that they are clueless about inflammation? This is one of the take-home points in the talk, because the endothelial burn, endothelium is the lining in your heart arteries. Doctors as a whole have a very primitive understanding of the pathophysiology of the development of arterial plaque, the blockage changes inside your arteries, which I have talked about related to the toxic metals, not to cholesterol, and even less of a graft of the inflammatory processes in the venous grafts. In other words, in the bypasses, which block off much more rapidly than your arteries themselves. I want you to remember endothelial burn. What should you remember? Endothelial burn, because that's how we're getting in trouble. Inflammatory blockage, the cells are rapidly activated by anything that stimulates. Oh, did I mention sugars and starches are stimulants to this inflammatory burn? They are pro-inflammatory, and that causes the cells to come into the area and start doing things. Doing things. When your body starts doing things, it's trying to clean up a mess and trying to patch it over so it goes away. You know what? Very often we're finding microbial activity, in other words, infection, in these injured sites, just like you do on your skin. So this is the skin inside your arteries, same behavior as the skin outside your body. Inflammatory blockage, that's atherosclerosis, that's hardening and blockage in your arteries. Progressive blood vessel injury, endothelial dysfunction, that's that lining getting burned, induction of that vascular inflammation, which continues, which is why the blockage tracks along inside your artery, And remember, we talked about plaque rupture or vulnerable plaque, where the caps can fly off. And even though the blood flow was fine, that piece of plaque is going to find something to cause a heart attack later down. Cholesterol is not the culprit. Fred Kummerow spent 70 years researching this biochemistry and blockage and said it's very simple. Endothelial injury is what causes plaque formation. That's the rusting in your arteries thanks to the inflammatory change. Now, oxidized lipids are not cholesterol, and that's often confusing as doctors don't understand oxidation chemistry as opposed to just a number of cholesterol on your test. The concentration of oxidation products rather than the level of cholesterol in the plasma is what deals with your blockage disease. In other words, we can very simply relate what's going on inside you to tests that we can see from the outside, but not the wrong tests, only the right tests. What causes inflammation? Air, water, food, life. Why? Well, I got to tell you, there's no clean air, no clean water, no clean food, and just the process of life involves inflammation because free radical chemistry, that's what it's called. Free radical chemistry is the way your body does a lot of the mechanical changes on the inside at a molecular level. In other words, it creates something that it can then quickly handle. That's the way it efficiently does a lot of the biochemistry changes. The problem is when pro-inflammatory toxins surround us constantly and put a challenge on, that's not what we should usually see. It's a burn. Remember I said this is a take-home message. They aren't controlling the burn. How about drugs that create inflammation? Remember that drugs are stoppers. They block biochemistry going on inside you. They stop those reactions because they're trying to interrupt the discomforts that you're feeling. That's what drugs are for, okay? But they result in aggravated inflammation changes. How about ethanol? You would know that as alcohol, not wood alcohol, regular old drinking, okay? Well, guess what? One of the things that the statin drugs have been found to do is to decrease the oxidative stress associated with drinking. Well, maybe that's why people think they're getting some benefit from it. On the other hand, I would like to think that we want to reduce the stress from the statin drugs as well. I've talked about the yeast syndrome many times in the past. It's my best-selling Bantam book from 1986, where we actually started talking about inflammation changes associated with the overgrowth of yeast and the toxins, the poisons that they produce. The doctors are unaware of my book and the details that describe in great detail how imbalanced growth of the yeast create many or most of our patients' discomforts and diseases. Many or most of our patients' discomforts and diseases. So if you have problems at your advancing age and we're not looking at the prospect of controlling yeast overgrowth, guess what? We're not treating the blister because of removing the shoe. We're putting fancier and fancier bandages on the blister. The shoe would be the yeast syndrome, creating more and more toxins, creating more blister, more inflammation, more endothelial burn, and we just watch it happen while we try to use bigger, better treatments. There's something called the microbiome. Now, you might have heard the microbiome, okay? That's the gut bacteria growing inside you that are natural and normal, unless, of course, they get abnormal because of cortisones and antibiotics and bad diet and so on. Well, take a look at Crohn's disease. That's a bowel disease, an inflammatory bowel disease. They have much higher levels of fungus growing inside. That's the microbiome, not the micro. The micro is the bacteria and the collection of all of the others. The myco is the collection of the fungus. These organisms work together to form robust biofilms. That's mucus linings that protect them from being defeated by any of your attempts to do it or even the drugs, okay? And that enhances the intestinal inflammation. Antifungals or probiotics, we've been using that for many years. And guess what? Ulcerative colitis, Crohn's disease, these kinds of things can be readily treated, not necessarily operated. I trained in general surgery. We used to operate on these folks and take pieces out because they were involved in this inflammation. It's just an infection process with inflammation resulting. Why not treat it? How about intravascular fungal biofilm? It's one thing to talk about inside the lining of the gut. What about inside the lining of your blood vessels? We're finding lingering infections there. 8,800 bacteria can infect human beings. Okay, but only a few dozen do. Dozens of thousands of fungus can infect human beings, and we see just a half a dozen or dozen that seem to be the important guys. Those folks get to be really important. We call it deep blood fungus. We can actually draw the blood out of you, that's called peripheral blood, and send it off and take a look, and guess what we can find? These deep blood fungus in serious illness patients. Oh, that's the reason we drew the blood out of you, because you are showing serious illness. If we take filters out of people, they put in these filters to help block clots and stuff, guess what we find? The fungus. Guess what we find in the blockage disease from arteries? Will we've removed that? The fungus. Whoa, that's the main culprit in this atheroma, this blockage disease. In other words, this is another part creating the endothelial burn that doctors are missing because they don't recognize that there could actually be a fungus among us. Now, the analysis shows that the vast overwhelming majority of the ones that we can look at, because our testing still is not that good, are showing fungi and protozoa. Those are parasites. We talk about amoeba in Mexico and stuff. There's a whole bunch of protozoa or parasites that get involved, and they appear to play a role in the blood vessel disease and the blockage formation, and your doctor is just not thinking about it. I want you to think that inflammation, that's endothelial burn, is infection, is immunity, and of course as you get compromised immunity, you have more infection and inflammation, and all of these are associated with membrane damage and mitochondrial injury. Doesn't mean much to you. It's exactly what I'm looking for when you walk in the door, because if I can fix those things, everything else gets better. Why? Because God put the system together. It knows how to heal. That's the fun part about it. Our results support that the role of autoantibodies, in other words, autoimmune disease, is absolutely critical in cardiovascular disease, often related, incidentally, to fungus infection. How about that? What about tip infections at the bottom of your teeth where they plant in the jaws? For years we've known that periodontal disease, gum disease, and jaw disease relates to it, but I got news for you. It's absolutely critical for controlling your heart artery disease. Here's a question. Are you kidding me? 13 of 19 studies found a positive association between apical periodontitis, that's the tip infection of the tooth in the jaw, and heart disease. And although most of the published studies show this positive association, the conclusion by regular doctors and dentists is the quality of the existing evidence is moderate to low, and a causal relationship cannot be established. In other words, by the time they establish one, you'll be long dead, because the old ideas die very hard. They die with the old doctors. That's what happens, because the old story, you can't teach an old dog new tricks. A lot of old dogs out there. Hypoxemia, that's low oxygen levels. That creates inflammation. This is way beyond sleep apnea. Doctors mistakenly believe that a breathing patient has sufficient oxygen in his blood, and several of the factors that need to be considered are ignored. So what do? They put you on CPAP, which just blows, I call it the scuba dive. It blows room air, which is not what you need. You need more oxygen. How about sleep disorders are associated with more than 60 diseases. Sleep disorders induce low blood oxygen, and there's associated with a whole bunch of changes inside the blood biochemistry and your organs. Hormonal imbalances, they relate to inflammation. Thyroid, testosterone, female and male hormones, adrenaline, and insulin, just to name a few. Those are profound interactions that are casually disregarded. Well, that's not my field. You need to go see the endocrine doctor or the other doctor, but I'm taking care of your heart. Wait a minute. What if this is associated with causing your heart problem? Type 2 diabetes, okay, that's where we give drugs first and then finally insulin for you as you're getting older. And it turns out that the more insulin we give, the more problem you have with your cardiovascular, your heart system. It's an interesting chase the tail of that dog there. Inflammation, hardening the arteries, high blood pressure, fat disturbances, heart failure, arrhythmias, rhythm disturbances, and more insulin and blood sugar problems. In 1940, we asked the question, can we poison the planet? The good news is, as societies have gradually transitioned from the farm to the city, the answer is a resounding yes. We have done it to ourselves. We have made it very difficult to get along outside there because the food chain is so thoroughly distorted anymore. Agricultural products are contaminated because we no longer have farm foods, we have agribusiness foods. We no longer have fresh foods, we have preserved foods. We no longer have fresh foods, we have canned and frozen and all that, and they're sprayed with chemicals that nobody knows the name of. But here's one they know the name: Roundup. Roundup, associated is the most significant environmental toxin now. Monsanto has achieved their goal. It is used worldwide. It's the most popular herbicide in use. Roundup Brain, guess what? It provokes severe oxidative stress in specific brain regions. Oh, wait a minute, substantia nigra. That's the one associated with the increase in Parkinson's disease. Probably has nothing to do with it. Cortex is your thinking part. So as you're getting older and saying, I'm kind of getting older, it's aging changes. No, it's diseases happening one day at a time. And often those diseases are associated with being poisoned. Very, very serious stuff. The use of Roundup. The current standards are absolutely outdated and fail to protect public health. So we think the government is doing their job to protect us by establishing standards. We're the government, and we're lax. We're paying no attention, and neither is the government. How about toxic metals like mercury, which create inflammation? Mercury is associated with high blood pressure, heart disease, heart attack, stroke, and so on. It inactivates enzyme functions that I've talked about, where you have normal minerals that activate your enzymes and do the job, and this is not happening. This is not happening for your repair processes inside. So you have a decreased oxidant defense. In other words, you're going to burn faster, and you have increased oxidative stress, which means you're going to burn faster. Can you see how this accelerates everything? Mercury is associated with heart failure. They found an interesting study. 22,000 times the normal expected amount of mercury in heart tissue in some specific patients. Whoa! Wouldn't you like, if you're that patient, for your doctor to be paying attention to getting the mercury out? Kind of like, get the lead out, which incidentally is also a problem. Lead inflammation is associated with lots of adverse effects. Increased levels of inflammation markers are associated with increased levels of lead. In other words, we know these things. It's not news. In March of 2014, a fellow presents with high blood pressure and stuff like this. Guess what he's found to have? Lead poisoning. This was reported in 1983 in the Green Journal of Medicine about lead and such. Guess what? If you get the blood lead down, the symptoms go away. So maybe you should doubt your heart doctor if he's clueless about inflammation. Now, what about if he's clueless about nutrition? We've got a whole nother issue here. On the EKGs, it's very common to see on the report diastolic dysfunction. In other words, we used to think that contraction was active, but it just let go and relaxed. Now we know that contraction is active and relaxation is active, and relaxation must have magnesium on board. And what did I say that we are low on? Magnesium. Oh goodness. About 5 million people in the United States diagnosed with heart failure. And guess what? The total magnesium intake is dramatically low in those folks, and the doctors say you don't need to take extra vitamins, don't worry about it. We can actually predict the risk of heart failure depending on your magnesium levels. Doctors make two key blunders with regard to high blood pressure, hypertension. They treat aggressively with drugs, after 1 or 2 elevated readings often, and they ignore magnesium deficiency and other contributing food factors. Why? Well, that's not what they do. See, they treat your blood pressure. They don't have to worry about the nutrition part. Well, no, wait a minute. Remember, we've talked about hypotension, high blood pressure controlled too aggressively. The overly aggressive blood pressure lowering, especially the bottom number, may impair heart perfusion or heart blood circulation, as well as brain perfusion. We talked about the cognitive change, the fog and the falls. Well, guess what? There is evidence for the benefit of lower blood pressure targets, but not too low. Magnesium, incidentally, lowers blood pressure. There's a significantly greater reduction in people getting enough magnesium, and supplementation dramatically affects some patients, especially those with insulin resistance and prediabetes. Raise your hand if that's you, because as we get older, that's our population now. My friend Jerry Reven was the one who first diagnosed insulin resistance, or what he called Syndrome X, in 1988 when he presented to the American Diabetic Association, because he was still trying to figure out what all these things were. Well, it's the growing older with the sugars and the carbs, which I've already talked with you about, creating the heart disease and so on. Angina, chest pains. Doctors jump to nitrates and other drugs, apparently ignorant of how nutritional deficiencies create or contribute to these particular problems inside. And indeed, fixing those is often not that hard. Magnesium deficiency contributes to worsening heart rhythms and other complications in your heart. CYP450, who knows what that means? Basically, you have detoxification systems inside your body. They work for all the stuff that you produce that needs to be detoxified, and the drugs that slip in, and the other toxins from the environment that slip in and need to be taken care of. Well, guess what? Detoxification mechanisms are absolutely critical. You've got to recover function or you lose it. The enzymes in your heart that do the detoxification, guess what? The metabolism is influenced by lots of factors, and the survival of those heart cells during any lower blood flow and such is critical. Well, I've talked with you about various things about the survival. You better have all of them in place. So why should you doubt your doctor? Well, we've talked about the tests that are problems, the drugs that are problems, the operations that are problems, the inflammation, the endothelial burn that's a problem, the nutrition that's a problem. Wait a minute. Those are all the tools that they use or don't use. Okay, maybe we need a different specialist to take care of your heart, or maybe an additional specialist. So the things that we don't do, sure, we want your heart doctor to do. But what should you do? Well, you should look for the good news regarding the tests, the drugs, the operations, the inflammation, and the nutrition. That should be cause for celebration, because there are things you literally can do to dramatically change your risk factors associated with heart disease. So let's take the solution with regard to tests, okay? The best test? Well, I think Will Rogers had it right. Personally, I've always felt the best doctor in the world is the veterinarian. He's just got to know what's wrong. He can't ask his patients what's the matter. Okay. Well, in actual fact, if you don't know the questions to ask the patient, you don't know what's the matter either. And if you're interrupting the patient when they're trying to tell you the story, you don't know what's wrong. But the difference between a generalist and a specialist is a generalist thinks that he can help what you got. A specialist thinks you got what he helps. Cardiologist, you got it. Okay. Hands-on physical exam, an outdated procedure in a lot of conditions because doctors often don't do it. Just take a listen, just take the measurements, look at what's going on, and attention to fungus changes on the toenails and other areas of your body, because that might be an indicator of the toxicity going on, creating burn on the inside. A complete physical includes a long list of things which we're not going to go into now, but it means touching the patient. It means looking at the patient. But remember, we're very busy ordering tests and treatments. Maybe we got enough information, we'll go with that, okay? Exercise tolerance doesn't necessarily have to be a stress test. There's something called the Master's Double Standard Two-Step Exercise Test from a lot of years ago. And guess what? It's a very sensitive predictor of hidden heart artery disease. In other words, we have you step up and down and up and down, up and down. And when you fail that test, we're going to look more closely at you. Echocardiogram, non-invasive, very easy. It's sonar, okay? Provides a quick and safe evaluation looking at the heart output and how it's moving and the valves and stuff. That's so easy, and that's so inexpensive and so unrisky. How about the ultra-fast heart scan? It's a highly specialized CT or CAT scan that is non-invasive and tells us an idea about the kind of blockage that you've got going on the inside. Non-invasive diagnostics, that is the preeminent role in diagnosing heart disease and should be the treatment of choice. But, we've got so many imaging modalities available, you keep looking at this from different directions and decide who should take the risk of angiograms, who should take the risk of possible stenting or bypass. That's important to know. You would think that it would be evidence-based. Doctors blow their horn about we do evidence-based medicine, but they routinely ignore the facts and studies that inconveniently show inconsistent evidence with their bias. In other words, they have a bias, I don't know, we'll wait and find out more. Here's something here. Among stable outpatients presented with suspected heart disease, most patients experiencing clinical events have measured coronary artery calcium, that's from the heart scan, at baseline, while less than half have any abnormalities on their functional testing. In other words, wait a minute, we ought to be doing more CAT scans, or heart scan is what it's called. We ought to be doing more of that because we can see more of the people we ought to be paying more attention to. I've talked with you about unstable plaque rupture, that cap flying off. Many doctors are unaware of advancing technology that can identify and monitor patients who have more of the inflammatory risk factors for the degradation of those plaque caps. In other words, for an embolic or blockage event. How about essential fatty acids called EPA? It has an anti-atherosclerotic effect. Fish oils. Guess what? It can help to stabilize the cap on those plaques, stabilize the plaques themselves. There's increasing evidence on how to use that properly. How about hypercoagulability? It's where you get thick blood and you start sticking on the inside. It's not just like with regular blood thinners. It's actually much more complicated than that. It's called a blood viscosity issue. And, there are ways of looking at this, and there are diseases that particularly aggravate it. What are the solution with regard to drugs? Well, the old-fashioned drugs are too simple, and doctors readily abandon the use of older medications in favor of newer protocols, ignoring the drug actions that might be insufficient to create the same effect as the older drugs did. Example, congestive heart failure kills. It's been well treated for centuries with something called Lanoxin, or old name was Foxglove and Digitalis and so on. Congestive heart failure killed my dad. Now, he was very wonderfully maintained on Lanoxin for years. And then he got in trouble with surgery and pneumonia and so on. His doctors outright refused to restart the Lanoxin after complications of his plastic surgery. Now, their use of beta blockers and diuretics led to repeated episodes of congestive heart failure, each leading to several days return to the hospital from the skilled care facility. And during each stay in the hospital, he was given advanced generation antibiotics for pneumonia, which he didn't have. But the protocol, the standard of care, requires that. No Lanoxin, no. Despite repeated failures of their modern attempts to prevent and control his congestive failure. I predicted his return to the hospital within 5 days of each of those events, saying he's slipping into failure, he needs his Lanoxin, and they refused. Okay? Should have been an answer. Combo care. Several drugs. A combination of drugs is an experiment on any one patient. It's a situation that's not investigated or evaluated or approved when newer drugs are introduced. But you know what? Smaller dosages of different drugs might minimize adverse effects. In other words, you reduce the effects of bad drug behavior by having less of it around, but it's helped out, it's amplified by smaller doses of something else. And instead, we end up with higher doses of too many. I was talking with you about Lanoxin or Digitalis. Doctors, especially younger ones, are totally unaware of the few drugs for which brand medically necessary is required. In this case, Lanoxin is a prime example. Another one is Coumadin, warfarin. Drugs such as Lanoxin and Coumadin are picture window bathtub drain examples where doctors must manage the dosages in order to achieve the therapeutic effect. Not less, not more. Here's the picture window. You start at the floor where you have no lanoxin on board and you want to get up to where you can see out the window. If you get too high, you're blocked by the top wall. So you need to get right here in this range where you can look out the window. This is sophisticated. You actually have to pay attention to the patient and do the testing and understand what you're after. Here's the bathtub drain. You know, if you put the water in the tub and then just turn it off, gradually the water goes out. Think of that as drug metabolism. So we have finally achieved the right level where we can look out the picture window. All we have to do now is put in enough to keep it at that level because the body is constantly draining it off. Very simple understanding. Most doctors not now trained in how to do that. They have their fancy protocols. How about anticoagulation? Well, let's avoid Coumadin and warfarin. The recently introduced quick and easy anticoagulants have deadly side effects. They are not reversible. One mistake inside your biochemistry can prove fatal to the patient. Not so with Coumadin. One of my first books was on Coumadin back 40 years ago, some 45 years ago. Statins. PCSK9 protein blockers. Fancy name. Cholesterol control agents. They were cautioned by Denham Harmon in 1957 as being dangerous. He even said margarine disrupts normal physiology, but the new thing coming in is PCSK9s, woefully expensive, but you don't have to take it every day. You just get an injection for a few $1,000s every few weeks, and your cholesterol is fine. But remember, cholesterol is not the culprit. Reasonable targets. Wouldn't it be nice if laboratory tests available had led doctors to set some expectations that weren't so severe or so rigid, regardless for the numbers, but we look at the whole patient? That would be important. Hormonal support is absolutely critical. We like to ease into this and get all these things in balance because this is what your body has had all these years when you were younger and felt better. Why don't we restore balanced hormonal systems inside you and let your body repair? Here's an odd one. Hypothyroid heart failure, or hypoparathyroid. The parathyroid gland is generally ignored because, as doctors learn in medical school, it's no big deal, except for the fact when it is. So there was a wonderful case report of severe impairment of the left heart. That's your pumping chamber for your body. It's called a dilated cardiomyopathy. I have to charge you more now because I gave you the Latin on it, okay? This patient had undergone, say, a subtotal thyroidectomy. That means they chunked out his thyroid. Well, guess where the parathyroids live? Right there in the thyroid. Well, guess what? He had therefore gradually over time developed low parathyroid hormone, which interferes with your calcium-magnesium balance, and he got into trouble. And all they had to do was put in calcium and vitamin D, and he got out of trouble. Remember, the body never does anything wrong. It always does it right. Sometimes we create the setting in which we better be smart enough to get it back to right. What's the solution with regard to operations? In the early 1980s, the major center study showed that 5 out of 6 bypass operations provided no survival benefit. And our medical management back then, almost 40 years ago, was primitive compared to what we have available now. Now we have minimally invasive surgery. That's where they can actually go through a window in your ribs. They don't have to cut right down the center. And we've got robotics, and we've got angioplastic surgery, and these options are being developed, but they require equipment and expertise to be deployed. Oh, wait a minute, I'm sorry. You know, your insurance plan doesn't cover that hospital or those doctors. Really? I bought insurance in order to survive, not to be exposed. That's right, but you can't go to that doctor because that's not what we cover. Great. The beating heart bypass was developed 45 years ago at my medical school. Jay Ankeny did some of the early work. It's where they don't put you on the pump. Very sophisticated surgery. Done often down at the Texas Medical Center now by the skilled surgeons. This kind of technique can make a huge difference, so you want to find out what your doctor is planning to do for you. Bypass grafts, okay, 4 per procedure. Okay. And the mean age at the time of surgery is 70 in these patients, okay. And the 30-day mortality was about 2%. The predicted mortality should be about 5%. But the off coronary artery bypass pump, okay, coupled with this novel metabolic protocol they used, showed very low. In other words, they reduced the operative mortality. If they did it right with the beating heart bypass and managed some of the other little things, that made a dramatic difference in your surgical survival. External counter pulsation, significant recovery when they used external pulsatile support. Yeah, it's fun. They put air cuffs on your legs, and when your heart is in the resting phase, they pump up and help push blood to the vital organs in your brain and your heart. Hey, that really helps. It allows your heart to recover. What's the solution with the endothelial burn, the cluelessness about inflammation? Hey guys, smoking. Sure, you can smoke if you want. Just remember you're creating endothelial burn. Ferritin is a major indicator of inflammation. CRP, we hear about the glycohemoglobin for diabetes and so on. There's a number of markers we can use to identify, you better pay more attention, because even though you don't feel bad, we see things coming. Smoking creates the flames inside. We can see significantly higher values. Those markers of inflammation are associated to the pack years of smoking. If you smoke a pack a day for 10 years, it's 10 pack years. If you smoke 2 packs a day for 20 years, it's 40 pack years. Higher risk for smoking and heart disease. Anti-infection treatment for the yeast syndrome, for deep blood fungus, for other parasite infections, deep bacterial infections, and sometimes the intermediate organisms, the ones that we find that's not like just your regular strep throat and stuff, they don't respond the way we want to. We've got to be smarter. The chronic viral infections require metabolic treatment because there is no really good drugs that help with that. An elevated cholesterol might actually be a protective stratagem that your body is using because it can wrap around toxins from the fungus. So here you've got a higher blood cholesterol to protect you from an inside infection your doctors haven't yet seen, and they want to lower your protection. Okay, guys, whatever. Yeast targets your metabolism. Candida toxins, that's what they're called, Candida poisons, interfere profoundly with metabolic junctures. That results in lowered levels of magnesium and B6, essential fatty acids, the EPA we talked about, and others. What is this like? Well, if you wanted to block the traffic flow in Houston, what do? You don't have to block all the cars, just about 20 intersections, and then it just all backs up. And then we're all in gridlock. You don't have to remove all the cars that are in gridlock, just those 20, and let things finally sort out. That's what yeast does to recycle you, is it blocks critical areas, the toxic metals block the others, and we call it aging, and then you have a disease. Suddenly you have a disease. No, that's the disease you developed over time. We called aging-related degeneration or decline. In other words, if we're not looking for it, we don't see it. Biofilms and parasites. People go, what do you mean biofilm? Don't brush your teeth tonight. Tomorrow morning, swish your tongue around inside your mouth. That's a real good example of a biofilm. Every wet surface we have has a biofilm on it. That's how it stays in good shape. Well, you want a good biofilm, not a bad one. Well, guess what? Oral pathology, in other words, bad infections associated with cavities and gingival or gum disease, root canals, jaw infections, and other biological dentistry complications are associated with an increased level of in the blood vessel infections with bacteria, parasites, fungi, viruses, all undiagnosed. Parasitic infection is very likely causative or contributing to many idiopathic diseases. Idiopathic means the idiots don't understand the pathology. Okay? That means we haven't found it yet. In 1923, we thought people with high blood sugar were kind of weird, and they would get crazy and all sorts of other things. In 1924, Banting discovered insulin. Oh, wait a minute. That's what their problem is. It was idiopathic in 1923. It was explainable in 1924. We're 100 years later and now looking at some very sophisticated illnesses that we are ignoring the evidence on, and yet that is what's causing so many of our diseases. That's perhaps the most exciting vista in our new world. Well, let's talk about it. Parasitic invasion needs to be treated, but we also need to reduce the exposures in our life. Now, it's often obvious, but in the rush of patient visits, simple advice to avoid the shoe causing the blister could make all that much sense. The patient's environment is critical for his well-being for the future. It might also be critical for restoring his health. Now, if he's got lead pipes in the house, hey, we got to eliminate that as a water source because he's continuing to put toxic stuff in. So we've got to look at the big picture, the holistic picture for the patient. Ferritin was looked at this is 7 years ago, in eastern Finland. A 3-year observation showed if you were higher than 100 micrograms per liter, you had a greater risk of heart attack. Yeah, okay, so the Mayo Clinic says you can be up to 336 and be normal. Now, wait a minute. In eastern Finland, they said if you're higher than 100, you can be in trouble, but your doctors look at a test and 336, well, that's okay. Ferritin above 500 kills you 5 times more likely from heart attack. In other words, 100 would be an okay risk level for heart attack, okay? 200 would be double, 300 would be more than triple, 400, 500 would be more than 5 times likely because it's a measure of inflammation. Aging and biochemical stresses, dietary deficiencies of antioxidants, the presence of toxic metals, all of these appear to induce what's called acidotic changes, where normal transference switches over to ferritin. More research is needed to understand this, but I'll give you an example. Babies are soft and rubbery and smell good. Older folks are none of the same. Babies are alkalotic. As we age, we become acidotic. Acidosis is the endothelial burn, the free radicals, the acid changes. That's what we're looking for as markers to identify these things. Toxic metals impair virtually all metabolic processes in every tissue of your body. It's a stealthy attack. It goes unsuspected, untested, undiagnosed, untreated by conventional doctors. Why? They don't learn about that. Remember, wait a minute. You don't understand. I'm a cardiologist. You want to talk about that? Go talk to one of those doctors. But wait a minute. If this is the shoe causing the blister, shouldn't that be high on his list of making sure to find out and say who you should go see? EDTA chelation therapy reduces the body burden of toxic metals, reducing the damaging effects of inflammation in all the organs. Interestingly enough, my friend Jimmy Howell did the very first bypass operation in 1964. He was one of the junior partners for DeBakey. Well, Jimmy Howell had a very open idea about chelation therapy. I'd send him to the patients who need surgery, and he'd send them back and say, keep doing that chelation. Interesting. In other words, he was a holistic kind of doctor in a very odd way, because surgeons aren't holistic. Oh, yes, they are, if they understand the pathology and the physiology and how you can restore better function. What about organic chemical toxins? The Hubbard method is the only way to remove toxins from the body fats and the membranes, the lipid membranes in your cells, inside and outside. And guess what? That is mostly used by fire brigades because they go charging in to warehouses where all this stuff is burning and God knows what it is, okay? And they get sick. What do you do with a whole brigade that gets sick? Well, you put them all on disability for the next 40 years. No. You find out that they got exposed to chemical toxins, you put them through the Hubbard method, and they all recover and resume work. In other words, if you get the right treatment, it makes it simple. You know, close counts. Close counts in horseshoes, hand grenades, and shotguns. But you got to have the right treatment for the right problem to get the right result. So what is the solution with regard to nutrition? Thomas Edison said the doctor of the future will give no medicine, but will interest his or her patients in the care of the human frame, in a proper diet, and in the cause and prevention of disease. You're here, you're learning about the cause of these diseases, and guess what? All of these things are associated also with the prevention of these diseases, because the slower you get sick, the longer you live a healthy life of comfort and capability. In other words, you don't seem to be aging as much as others. What about the 50-year-old who looks 60? The 50-year-old who looks 40? What's that 20-year difference? Their rate of aging, which is their rate of disease, which is their rate of damage and injury on the inside, which is associated with these factors that we've talked about. Life. Life is amino acids and fatty acids and nucleic acids, sugar, starches, minerals, vitamins, water, and lots more, and not drugs. Life isn't associated with drugs. You don't give a kid drugs to make them grow and develop. That's important to understand. We can get intoxicated by water by overdrinking. Excessive intake is rare, but in the heat of summer and the press of exercise or exertion that's doing the yard and all that other stuff, more often people are camels. They usually never drink enough water in their daily lives, but out there they can get in serious trouble with their heart and blood vessel system. Fibrinogen control, nattokinase, serrapeptase, lumbokinase. These are oral enzyme formulas that degrade these sticky things that get stuck in your blood vessels and cause early clots that can kill you. Now, what's interesting is, guess what? When you go to the hospital with a stroke or with a heart attack, what do they hit you with? A clot buster. It's an expensive IV form of these kinds of drugs. I mean, it's very expensive. On the other hand, getting that clot to break up rather than stay in place is essential for your long-term survival. What about magnesium? It's dramatically deficient in modern diets. The effects of lower magnesium are profound, especially in your heart and blood vessel system. Millie Seelig was a cutie. She stood about 4'10" on a really tall, good day. And she did the research in 1970s and 80s showing how low we were in magnesium. Now, you would think if you're low in magnesium, you're going to open the gates in your gut so that any that comes through you're going to absorb. That's what you do with zinc and copper and manganese and so on. But with magnesium, the lower you get, the more the gates close. It's the only one that they could find doing this. And you go, well, that doesn't make sense. Well, it does. Remember, the body never does anything wrong. But if you take a look back in human history, there was so much magnesium in the environment. We're eating, weeds and leaves and trees and whatever. Okay, so we're getting a lot of magnesium coming in. 15 times more is the estimate than what we get on a daily basis now. If you don't handle magnesium well, we need to remove you from the gene pool. We close this down and kill you off. Okay, we don't need you reproducing. Something's sick about you because you're not adequately magnesium maintained, which is important. At least 300 enzyme reactions now, and the more we investigate, the more we find. Millie proposed that we needed to add more magnesium in the coronary care unit IVs and stuff because that's so dramatically important. When do you think that finally happened? Well, it's coming into place now in the last few years. I mean, the last few, okay? Because it's not been routine protocol for the longest time. But we have the best heart doctors. What about vitamin B6? It's misunderstood by even many who have training in nutrition, but it's centrally, it's a cofactor, incidentally, for most of the magnesium reactions and a lot of other enzyme reactions, the worker bees inside your system. A broad range of metabolic processes, including heart function. And I got news for you. This is very important, if what you do is take care of yourself, okay, with vitamin B6 level, you have a dramatically lower risk of heart disease. CoQ10, that's the crown jewel in the energy production. It's a victim of statin drugs at any dosage. In other words, it gets you in dramatic trouble. What about nitric oxide inducers? Beet preparation. You hear about this? We've been using them for years now. Nobel Prize in the 1990s for understanding how this opens circulation and improves function. How about omega-3 fatty acids, the EPA, the fish oils and such? There is little that needs to be said of the essential fatty acids in maintaining your body on the inside. Guess what? Your doctor will hardly know a thing about it. EPA reduces plaque lipids, in other words, the fats in the blockage disease in your blood vessels, and it stabilizes the diseases that are developed. Antioxidant deficiency, that's free radical suppression. If you don't have it, it don't happen. Cholesterol is not the culprit. Having enough free radical suppression or control, which is vitamin C. That's so important, combined with lysine that can actually reduce cardiovascular diseases and cancers. Vitamin E, the role of natural vitamin E in preventing and reducing heart disease has been known since the 50s. It does much more than just that. Bioflavonoids, long misunderstood with regard to the interactions with vitamin C and other antioxidants. Recent research shows these are essential for control of the inflammation. Glutathione, the master antioxidant. We've got to find better ways to raise the intracellular levels because most of the stuff in the nutritional industry is just fake news. How about L-carnitine? Originally it was called vitamin B sub T, but it's essential for the proper metabolism of fatty acids and others which are associated with the energy pathways. What about alpha lipoic acid? essential for energy, but it's also very protective of liver and other places inside your body. Detox. We can reverse antioxidant stress. The protective role against pesticide-induced damage. Remember Roundup? Pesticide-induced damage suggests that the LA administration is a promising strategy to cope with disorders suspected to be caused by these oxidation stress generators, especially in your brain. Now, there's some of the folks who seem to be aging early and had such wonderful gardens, used too much pesticide. What about iodine? No discussion would be complete without talking about deficient iodine status and thyroid function. Iodine has a lot of other functions we don't even discuss. Herbals and homeopathics. You know, earlier civilizations figured a lot of this out. And, you know, Hahnemann did the water formulas, the homeopathics and stuff. Some of these can produce stunning results in people. The old Indian cultures, the Indian medicine man, the African medicine man, all this, you know, they actually took care of a lot of these problems. Sugars and starches. Let's remember that SAD is the standard American diet. Anyone who wonders where metabolic syndrome, insulin resistance, diabetes, Alzheimer's is considered diabetes type 3 now. Look at the prepared food diet. We don't get enough protein because we've been scared away from the meats and the eggs, the butter and the cream and raw nuts and stuff. Did you know raw nuts are important to cut your risk of heart attack? In 1970, they found you could cut it by up to 60% by just eating nuts 5 or more times a week. Interesting. We don't understand that mechanism completely. What about fungal infection and heart disease? Fungal DNA is found in 92% of the heart artery patients that are studied. Ooh, and there's a polymicrobial. In other words, it's not just fungus. We find bacteria and parasites. Chronic inflammation. Remember the endothelial burn. Fungus and heart disease. Remember that lovastatin, which is a statin drug. Okay. Well, you know, that actually kills fungus. Woo. Maybe that's its primary therapeutic benefit. Maybe we should use fungus killers instead of that. Fungal Bionics was a book written in 1994. There is a known cause of atherosclerosis, and that causes fungus, and their mycotoxins. Fungus and heart disease, oh my God, yes, we find it. It causes inflammation or burn on the inside of the arteries, especially for the heart. Incidentally, we're now beginning to associate overgrowth by Candida and other species in the deep blood fungus with brain and other blood vessel inflammation. Recall that cholesterol binds the mycotoxin, wrapping it up, making it much less harmful to the body, so maybe we ought to not be avoiding cholesterol foods. For instance, you know, eat eggs to avoid heart attacks. A study done in 1960 by the American Cancer Society, wait a minute, why aren't they promoting this? Showed that 5 eggs a week had fewer heart attacks. Jeez, wonder if that's healing the scuffed linings or protecting against fungus. Remember, we all get secret salt. We've tried to avoid salt, but we get pickles and peanuts and pretzels and chips. We get a substantial salt load. We need to get frequent water, small volumes, those little Dixie cups, those 4 ounces, through the day. Works a whole lot better than glugging it down. It actually hydrates our cells correctly. Grazing, eating just here and there when you're hungry, not just at meal times. It reduces your glycemic load and index by actually eating the right foods at the right times for your body. And digestion needs to be working right. In other words, so many of us, by the time we're 40, are starting to get inefficient digestion systems. We've got to learn better how to take care of that. And the gut microbiome, the prebiotics, probiotics, the soluble fibers, and so on, the things that make good stuff grow on the inside and avoid the fungal growth on the inside, which doctors routinely ignore when they give antibiotics. They don't think you need anything to avoid overgrowth. Supplemental oxygen. You're going to hear more and more about that. I started doing research on that in 1993. It helps make your body more energetic, including your heart and your brain and so on. And unfortunately, doctors are poorly trained on how to use that. Walking, the simplest exercise. Walking. After that, walking. People want to do all these gym things and start go walking. If you just do that, you get cardiovascular tone, mobility, balance, and basal strength that's available to everybody. Getting enough sleep matters. It really does. The more we do sleep research, the more we find that people who get restful sleep live and feel better and longer. What about stress strategies? Oh, yeah, we're all subjected to stress all the time. That's a whole series of lectures on stress biochemistry, but prayer and meditation and having hobbies and enjoyable relationships and music and defined visual stimulation, not looking at all these weird games that they have on computers and such. You got to know that the future is here right now. We have things like frequency-specific microcurrent. We have magnets. We have other electrophysiologic processes that are here that make a difference. Harvesting the stem cells that can repair your body, absolutely critical to get the right ones. Often they are not. Often they are marketed differently or whatever, but it's not marketing. You need to find the package that performs, which you've been specializing in that. So I have to tell you, you should doubt your heart doctor, but trust yourself. Daily, you should do your weight, your exercise, your sleep, and food choices review. Occasionally do your blood pressure and your blood sugar, but not much. You now have solutions that you can trust with regard to tests and drugs and operations and inflammation and nutrition. And you know what? There's benefits to that. You actually can enjoy your golden years whenever they start, age 20, age 70, whatever. You have the opportunity to go on and be someone with comfort and capability, enjoying your life, because health is your greatest wealth. Why should you doubt your heart doctor? A physician in France, Jean-Jacques Clemenceau, who was premier of France during World War I, said, "War is too important to be left to the generals." I would argue that your health is too important to be left to your doctors. When your doctor's best isn't good enough, he might not be the brightest bulb. He might not be conscientious. He might not have your best ideas in mind. 98,000 Americans die each year from medical errors. About 210,000 deaths per year from preventable harm in hospitals. Serious harm seems to be a 10 to 20-fold more common than lethal harm. In other words, you get to suffer afterwards. You don't die. Isn't that reassuring? Isn't that good news? Researchers found the death rate among men was 48% lower during their hospital stay than women. Men were more likely to undergo an angiogram, a heart, pictures, catheterization that they need, and men were more likely to undergo angioplasty that they need. Wait, what about the women? Well, only about half of those Americans coming to the ER that survive get the proper care. That's a real problem. 2% of the misdiagnoses of acute heart attack in the ER is actually considered a low rate. 2% miss of what you got, and it's not changed lately. Of the patients sent home with unstable chest pains, an astounding 86% were seen by an attending physician who missed it. Not just a student, but a real doctor. 29% of those were seen by a heart specialist, a cardiologist, who missed it. And you go, wait a second, I'm counting on these guys to be the best. Well, of the 19 patients sent home with a misdiagnosis of having had a heart attack, 79% were seen personally by an attending physician, a senior doctor, and they missed it. Getting sent home when your heart is struggling and dying could have fatal results. So you know what's a good idea? Why don't we do things to protect ourselves to need this less and less often? Because life's risks are real. I mean, these are not joking things we talk about. We have a lot of fun in the office joking with our patients, but what you know, but you discount or ignore as being true is lying to yourself. These are the facts, as I'm presenting just the facts. What you know that is false, but you act as though it's true, kind of like cholesterol and statin drugs and such, is lying to yourself. What you don't know, but you act as though there's nothing more you need to know, lying to yourself. More ominously, what your doctor knows but discounts or ignores as being true is lying to you and could kill you. Okay? What your doctor knows that's false, but he acts as though it's true, is lying to you and could kill you. What your doctor doesn't know, but acts as though there's nothing more he needs to know, is lying to you and could kill you. So our professional challenge is an amateur practices until he gets it right. A professional practices until he can't get it wrong. So what you now know is that you should doubt your heart doctor. Maybe save your life. Orthomolecular medicine is a fancy term. It's about nutrition, alternative medicine. Linus Pauling coined the term. He says the right molecule is the sacred healing power of the life force within each of us. We seek the right drugs, the right operations, the right alternatives, and the right information that we need to make these choices. That's orthomolecular. That's the right choice. Coming soon will be the book on this, Heartbroken, the top 5 reasons to doubt your heart doctor. It'll be the flagship volume in the Doubt Your Doctor series. I'm going to have various experts write up their experiences in their fields so that patients are guided through this maze of understanding what's available in integrative medicine now so they can get the best results, period. So, Heartbroken, the top 5 reasons to doubt your heart doctor. We give you a second chance for those who survived their first heart attack and those who want to. I would suggest you refer all of your friends to healthchoicesnow.com, because if you don't know that you have choices now, you don't have any. Life Celebrating Health, that's the name of our clinic. It's because the NASA folks developed all the highest they could understand in technology to create a space suit for people to survive in the hostile environment of space. We've never lost an astronaut on a spacewalk, period. We have our personal spacesuit that we walk around with in daily life. It's a hazardous environment. We need to take the best we can learn in all the biological and physiological and nutritional sciences and do it right. Because when life is your choice, failure is not an option. Thank you. You've been a wonderful audience today.